make it full.
The screen is shared.
Yeah. Screen is there, but make it full. Yeah. Now it is full. Okay.
I have opened my PPT. Are you
Yeah.
able to see? Hello. Can you hear me?
Yeah.
Yeah,
Yes,
yes,
sir.
sir.
It's going well.
Okay, G. Okay, G. So it will be a kind of a. There will be a conversation, I believe. It is not like that. Just I need to talk.
Yeah. Kind of conversation will do.
Of course, because I cannot see any of you, even myself, right now on the screen. I can just see just my PowerPoint presentation only.
Yeah.
So, very, very good evening, friends, and thank you, Dr. Ghanshyam, for inviting me in this such a wonderful online platform where we learn repertory and homeopathy and many more things, online repertory clinical training, a kind of a workshop, I can say, where you find more clinical things uh, as compared to the any theoretical things. So let's start with the case. Are you able to hear me?
Yes, it's very clear. Go
Okay,
ahead.
okay, Ji. So I really want to share this case, and through this case, I want to share you some of the beautiful things regarding how to analyze your case. So let's start with this particular person. So he's the guy around 30 years of age, and he consulted me at that time for his complaint of panic anxiety before 1 year. And by profession, he was a computer engineer. But on the first look, when I see him, I feel he was very anxious person. So just when we have some basic conversation regarding uh, exchanging the preliminary data and all the things, and after that he the basic case taking was started at that time. So at that time he told me when I was doing job at that time, I also feel a bit stressed. I was doing job in IT company before 1 year. Whenever I have started my new job, I got stressed. You just tick mark all these things, which I have written on italics, so that later on you will be able to understand case in a more better way. So even before that, whenever I go for an examination, I experience fear before 1 hour. Even during my job, one of my friend who was in a job would not be able to come because of he got a kind of a panic anxiety, and he also told me his symptoms like panic anxiety you'll find a kind of a anxiety in chest, nausea, vertigo, and all the thing. So at that time I ignore all these symptoms. Okay, that could be some kind of a issues and problem called panic anxiety, but just I neglect all these those talks and continue my job. So meanwhile, I needed to appear in one of the examination for regarding software engineering. So for the preparation of the examination, I quit the job and started my preparation for the examination. But this creates a pressure on me. What happen if I cannot pass my examination and select in government examination? As I had left my job, so I started at that time anxiety about my future, my career. One side there is a examination stress, and another side there is a stress regarding my career. So in that stress situation, I got palpitation in my abdomen and giddiness like feeling. And I remember my friend's symptoms. Okay, that is how he got attacked, a kind of panic attack, which was started 1 year before. So constantly I felt that there is something will going to happen to me, and this pressure overpower me. I cannot see properly at that time. I feel heaviness in the chest, feel constriction in the chest, feel constant anxiety and heaviness in the chest. I feel very much giddy. difficulty in breathing, and weight over my chest. At that time, I decided to go to my village as I was not feeling okay. So during traveling in that bus only, I got a panic attack and I feel that I could not reach at my home. I feel so panicky. I just come out from the bus and stayed at one of my friend's house in that particular village. So I was so frightened at that time and having a profuse perspiration and giddiness. At that time, I feel that I need to consult some doctor immediately. Otherwise, I will fall down. I become so restless at that time. I need to active my mind. Otherwise, I will fall down. Just I'm repeating the sentence. I need to active my mind. Otherwise, I will fall down. I feel there is no confidence in my body so that I can remain stable. I went to hospital for examination, but my pulse, blood pressure, cardiogram, all everything was normal. So at the time I feel that I cannot remain alone, otherwise something will going to happen. I will get vertigo and I will die. I couldn't sleep. Constant thoughts were coming to me, feel very much restlessness at that time. Suddenly I got up from sleep and again constant flow of thoughts starting in the morning, up to the morning. I still find difficulty in breathing and heaviness in my chest. So even in car, I cannot travel at that time when he has this episode of panic attack. I got frightened that sorry, I will get vertigo and I will fall down. I will die due to traveling. I cannot travel alone. So always at that time, my wife accompany me and I cannot remain alone. So after these incidents, I started psychiatric medicine, but still fear was there that I cannot go alone outside. I will fall down. So this is the story what he has told me at that time. Now how to proceed further into the case? Can anybody?
So you can share your ideas. What to do now? First of all, you have to decide at this stage what is the prominent area
Hmm.
or a topic from where we can start our further journey, right?
Yes, absolutely.
Yeah, so from initial talk, whatever the case,
Hmm.
from initial talk of 50 to 20 minutes, you have to decide and you have to anchor yourself. So from this thing, you will go ahead. So here, first tell me what is the area?
Can somebody answer?
Uh, yes, anybody answer? What is the area?
So here the person is very anxious, anxiety, anxious and fear of future,
Okay.
panicking, fear of falling, heaviness. Somewhat we have felt in such way. What exactly, he's also feeling giddiness, difficulty
Yes.
in breathing, just
Yeah.
because of fear of future and fear of falling.
Mm.
Sudden panic attacks are being seen in this patient.
Yes, absolutely. So in this case,
He
Because he's
anticipate
not having, yeah.
lot of anticipatory anxiety.
yes. Ghanshyam,
Uh,
can I see who are can I see the face of the person? Is it possible?
When you are talking and doing a full screen, at that time it's not possible to see people.
Okay.
Needed, I will announce the name.
What?
Okay. If needed, I will announce the name who is speaking.
Okay, not an issue.
Yeah.
Sir, Sir, it is because of anticipatory anxiety. It is because of performance pressure.
Mm-hmm.
He has to perform. He has to qualify. That's why he is worried about his future. For
Absolutely.
that, he got panicness, restlessness,
Mm-hmm.
fidgety, kind of feeling acute
Yes,
attacks. जो
absolutely.
आए.
Mm-hmm.
This is
So, but
because
in
of
this case, that is what our thinking right now, till whatever story we have here. Now, how to proceed further? What question should be asked? That is what I want to know from you. Till now, whatever we have gathered, now based on this, how will we proceed further during the case?
we can correlate it with mental rubrics,
No, no.
all his
During case
mind
taking, what we
symptoms.
will ask to your patient?
Okay,
Still, the case is not finished. So we
okay.
are not. We do not have to think of rubrics and anything.
Mhm.
Question is, if your patient is progress till now, and then what you do? This is the question.
During the case taking. Right now, I'm not talking regarding the analysis
Uh,
part. Right now, I want to discuss regarding in between the case. So till now, he has told us his own story. Now, how to proceed further?
we have to probe about his aggravation amelioration part, like how he feels better.
Okay, chalo. So, what question should we ask?
I would like to ask if there are any other associated complaints
Okay,
along with this. It's a mind complaint completely, but when
okay,
we are dealing with panic, then some of these complaints are common symptoms. Now, if
yes,
we want some PQRS, we can even think of physical generals
of course.
along with the mind. So we could ask some other concomitants of, the craving aversions or any other body physical complaints if he is having. Thank you.
Chalo. So, let's
Any causative factors
Like
in
How
the
Malak,
you
what is
feel
beginning?
the
about
stress?
the panic
What is the
attack
stress
time?
in the life?
How you feel
okay.
at the
In the
time of panic?
attack, how do you feel? Okay. So let's proceed further. Let's see what I have done.
Journey of the disease, how it started.
Absolutely. So,
So why does the patient feel here? Why I landed in the situation? Like what could be the reason you feel? How the patient feels? What was the reason that he landed in such a situations with all the symptoms?
I will
Trigger
not
factors, sir.
speak
Causative
much
factors.
regarding why at this particular stage of the case taking. Before, I will not. I can say use my mind during case taking. Why this happen? First, let me gather all the data from the patient. Then I will ask myself at the end of the case taking if it is required why. Otherwise, most of the time I will not ask why. Hmm. So what I have done, I have so because he has given me so much uh, information basically. Hmm. So that is why I have asked him, "Okay, out of all these things, what could be your worst fear?" Because he has told us so much so thing about the fear and what he's feeling in that particular fear and his experience in that fear, and there are many more fears. So I would not be able to select which one is the worst one, better to ask to my patient only. So that is what I have done. Okay, just tell me which one is the worst fear from all these things, whatever you have told us. So he told me, even the way he told me is again very typical, very systematically. Three worst fear. One is I will get giddiness. Second one is I will fall down. And third one is I will die. And because of these three fear, I do not want to go to remain alone. So how will you proceed further? Again,
What will happen if you remain alone?
what will happen?
When you are alone, why you have, why you get scared
Okay,
of being alone?
even in this, when he has given me three option, 1, 2, 3, then even I will not judge which one is a more version one. So again, I ask him, out of all these, which one is worst? Why I should think? So I asked him, out of all these, which one is worse? He told me fear of falling is worse for me. Why? Because of this particular fear, I lost my confidence. For him, out of these three fear, even I will die is not the worst fear. For him, the fear of falling down is a worse one. So just tick mark this thing, huh? I will get panic attack and I will fall down. My heart will stop and no one will meet me. How will I survive? And I cannot take breath and I will die. Psychiatric doctor told me in my body serotonin level is low and that is why I get panicky attack. After taking his medicine, I was not getting such attacks. I could go alone without any fear. But again, panic attacks start after 20-25 days when I need to take my mother in the hospital and doctor told me that she need to get operated. As soon as I heard about operation, again panic attack started. And at the time, the same symptoms, profuse perspiration, chest pain, breathlessness. Again, compared to before, intensity was less. So after that, I came back to Baroda as I want to read and give my examination. And now I got a fear of being alone. I got the fear of traveling. As soon I do traveling again, I will get panic attack. As I got my first panic attack during traveling. So I was used to such panic attack. I know I will not die. And intensity is quite less compared to before. He at that time he was on the psychiatric medicine. But I need to take psychiatric medicine since last 3 months. Doctor has started to reduce the dose, but after that, when he reduced the dose, another complaint started, headache. So when I am in present state, I am fine. But I started to think something negative about past or future, I will get headache. So for the headache, he was coming to me. I feel so much so confused. What to do further? I become blank at that time. Since 2 days, that heaviness and blankness is in my head. Again, I feel anxiety like before. I feel more at night after dinner. So when I ask him further, just tell me your experience in that anxiety. He tell me fear. Again, I ask him, tell me your experience in that fear. He was telling me the same kind of experience which he got even during the attack. Heaviness in the chest, perspiration in hand, food, feel negative all about, feel so frightened at that time and trembling. So something bad is going to happen to me or my wife or my family. That is what is constant in my mind. I feel more anxiety in my stomach, which is better after erection. I feel sudden startle of the body out of fear. Some feeling like when you get frightened. So that is what I perceive in his life. The basic thing is so much so fear-driven person, so much so anxiety-driven person, which tends to produce all these physical symptoms. So he has also fear during examination. Another thing is he has also phobia of height, and he cannot be stable at high place. I cannot see down. I am having that fear that I will fall down. Just remember, huh? Okay, he has also the worst fear is fear of falling down. The same phobia also he has, even in general. So when I asked him, tell me your experience in the fear. So at that time he told me, sudden you will move back and fear of falling and heaviness in the chest. Feel as if something will going to happen to me. I need to control myself. Fear that I will lose my control and fall down. I will lose my confidence on my body at that time. So when there is a fear, he has a lose his control of falling down, and there is no control on one's own body in that panicky situation. Confidence regarding standing, being stable, and not falling down. Any other fears? He told me I cannot enjoy rides. Same fear of falling from the rides, but at that time I cannot control myself. Same, I don't have confidence at that time on me, on my body. Confidence regarding controlling one's body is not there. My body will not support me at that time. Again, his sentence is, my body will not support me at that time whenever I am having a in such kind of fearful state. Are you able to convey with the case?
Yes.
Okay. I asked him further, any other fear? He told me the fear of water. So again, when patient tell me any specific thing, I ask him further and try to understand the what will be that person's experience even in that particular situation. For example, when he told me fear of water, I have not simply take it as a fear of water, but I asked him further and he told me at that time, not actually the fear of water, but fear of swimming. I feel anxiety that something is going to happen to me as my body is floating. When this body is in a floating way, at that time I am having a fear of losing control on my body and I will be drowned. So that is again the same kind of thing, same kind of experience he has also because of this fear of water. So in general nowadays my body become numb and I cannot move my body. Then consequently I need to move myself to get the confidence. Are you able to understand? Right now I feel numbness in my body and I cannot move, and at that time to get confidence, okay, my body is there, I need to move myself to understand yes, it is there and I have control on my body. So numbness is more on left side. So this is the case. Any comments?
Yes. You have
Yes.
any question you can ask.
Yes.
Specifically, share your understanding of the case. What you understand till now.
Okay. So let's I can say summarize the case and then we move further. Okay.
Yeah.
So these are the highlights of the case. Let's summarize case once again so that you will get the idea regarding the understanding of case. So getting stressed when new job and also before examination. When so it's a kind of summary. His friend got a panic attack, and after that he left job, which tends to produce a kind of a stressed, like should I need to give examination or should I think regarding my career. And experiencing stress would be palpitation with giddiness, restlessness sleep, difficulty in breathing, weight on the chest, person feels so much perspiration, trembling of hand and foot, frightened something will going to happen to me or my family, anxiety in stomach which will be ameliorated after erection, startling of the body out of fear. Then he has this episode during traveling, sudden panicky attack, and at that time again he has to stay to friend's home in between the journey. Again the same thing, perspiration, and need to consult someone, some doctor immediately, otherwise I will fall down. No confidence on my body that I can remain stable. I cannot remain alone. I will get vertigo and I will die. So these are the three worst fear: giddiness, falling down and death, and fear of being alone. Again get panic attack when mother was hospitalized. In the fear or in the he is also having this phobia of height, in which he feels fear of falling. Again at that time he feels the same experience, I need to control myself, I will lose my control and I will fall down. No confidence on body regarding being stable and not falling down. Again regarding the fear of water. He is having a more fear of swimming, fear of losing control over one's body. So this is the basic thing, huh? These are the gist, I can say, of the case. So based on this summary, can anybody share their experience? Now the analysis part will be there.
Yes, now you can share your understanding of the case.
That I will share. I would like to understand from the
In
attendant.
general to all.
Sir, I
Any
have
other?
taken only mental generals.
Okay.
Um,
Please go ahead. What
I'm
symptoms
sharing.
you have
It
taken?
is
What rubric you have
anticipation
taken?
examination before.
Okay.
Hello.
Hanji.
It is anxiety anticipation from fear of being
Okay.
alone, fear of
Okay.
losing control, fear death of, fear falling off, fear happen something will, fear of high places, fear sudden, fear sudden. This much. From this much, I am getting gelsemium, argentinum, and medorinum also. If I am taking fear of water in swimming,
Okay.
particularly coming. But by your analysis part, fear of losing his body, control over his body, I am thinking of giddiness, trembling, thinking of gelsemium more than all three.
Very good. Absolutely.
Hello,
Absolutely.
Malak
Thank you.
sir.
You are on the right
This is
way.
Dharmesh here. Hello,
Hanji.
Malak sir. This is
Hanji.
Dr. Dharmesh here.
Hanji, Dr.
Yeah,
Dharmesh.
to me, it looks like second column
Okay.
and second row
Okay.
seems to be, I think, third column. It looks to me as if this is borax.
Okay.
Acute miasm, clinging, need of support,
Okay.
fear of falling.
Okay.
So to me, it looks like borax more.
Okay. Very good. Any other suggestion?
Sir, I am feeling, sir.
Please
It
tell me
look
your
like
name.
carbon, sir. Carbon.
Please tell me your
Because of
name.
my name, sir, Dr. Alok Patel.
Okay.
Very good evening, sir.
Hanji.
So this patient look like carbon, sir. Carbon because of lots of numbness, lots of
Yes.
anxieties,
Yes.
too
Absolutely.
much panic. So
Yes.
it look like carbon, sir.
Yes. More?
So this is DSR Murthy.
Okay.
This is looking like Argentine nitricum.
Argentinum nitricum. Okay.
Yes.
Now, Robin, you talk.
Okay.
I would agree. I was going to say the same thing. I did a chart. Originally, it seemed to me very aconite-like, but as I put together the thread of his history and what comes out the most, this fear of heights, the anticipatory anxiety, even anxiety erectations ameliorate, anticipation for examination, the fear of falling, the fear of being alone while in death. What comes out the strongest is argentum nitricum.
Absolutely. Any more
Yeah.
suggestions?
Hello,
Now,
sir.
Silas, you talk.
Good evening, sir.
Yeah, good evening.
Ji, sir. Some rubrics selected. Fear alone of being, fear high places, fear falling off, self-control, loss of self-control, fear happen something will, anticipation, examination before, elements from anticipation, fear sudden, because panic attack. So referential rubric fear sudden or confidence want of self confidence. So two medicines is cover of these rubrics, argentum nitricum and gelsemium. My selection is argentum nitricum. Thank you, sir.
Now, Dr. Sweta, you will talk.
Hello, sir. Good evening, sir.
Good evening.
I feel the main thing in the case is fear of losing control. As he mentioned that if he lose control, he will fall down. So, all condition he is trying to control himself, and fear, anxiety, and anticipation is very marked in the case. So, I feel it is like he want to held by someone. Someone wants someone to be with him. So, I feel gelsemium here. Thank you, sir.
Very good. More?
Okay, now
I
talk.
think
I think argentum nitricum is the correct rubric, correct remedy in this case, because so many feelings are in correlation with the argentum nitricum.
Okay. Next one.
Sir, good evening. So here, prominent things in the case are fear, ordeal, anticipatory anxiety, examination funk, fear of heights, and soda water bottles, sir. He is getting irritations, and moreover, he wants confidence, want of confidence. Sir, here it's argentum nitricum, but there is also DD with gelsemium because he has doubt of losing his body balance, which is a bit prominent, which we can't neglect here. So DD with gelsemium. Thank you, sir.
Very good.
Now we look around differently. Last session we studied kingdoms, right? So
Okay.
which kingdom you look for this case? Now you have a little bit understanding of kingdoms. So which kingdom you can think of this entire case and why? Because we'll do analysis two way directly from the repertory point of view and understanding, general understanding according to themes of particular group of remedies. So which
Here the patient most of time asking for support and control. So it is it may be a mineral kingdom, not plant kingdom or animal kingdom. This must be a
Yes, very good.
Yes, very good.
Any other suggestion?
Also performance. So again the minerals.
Okay.
Good evening, Dr. Hares here.
Mhm.
It's a metal with carbon combination. I think so.
Okay. So which could be that metal which has a carbon combination? Tell me now.
Sir, I see the systematic patient fear in a systematic way. The fear the way described.
He wants he protected. He should not lose his performance in his position. It might be third row, ferrum near about ferrum or arsenic.
Okay.
With
Good.
any carbon.
Good suggestion. Any other?
Dr. Murthy, you will talk now.
So here, I also go with arsenical because he's very much anxious and restless about his own health. ये हो जाएगा, वो हो जाएगा. And fear of falling is there, no doubt in that. Fear of falling may come in arsenical also because 15th column, remedy of 15th column. So we can think, if we think in that way, then definitely fear of falling is there in arsenical. Argentum nitricum is the one जहाँ पर lack of confidence and anticipatory anxiety, if we are thinking about all those things, then argentum nitricum will go with argentum nitricum. Otherwise, when we see that he's changing doctors, he's so anxious and restless about his health, and so we can even think of arsenical here in this case, because he's also thinking about his family, my kids.
Sir, as anxiety from stomach, I think Kalikar, the way of systematic, and the anxiety prominently come from the stomach. Kalika maybe.
Again, very good suggestion, I can say. Okay. So should we move further? Or any other suggestion from your side? Hello.
It's perfect. Go ahead.
Chalo. So look, in this case, once your understanding regarding your patient become clear, now we need to proceed further how to approach this particular case. I will say there are two kind of approach what we can do in every case. I can say, I will not say in this particular case. One is to zoom into the case. if some those doctors who are using synergy homeopathic software, there are two kind of functions are there. One is zoom in and another is zoom out. So it's like, what is zoom in? Can anybody tell me what is zoom in?
Going into the details of
Yes.
each rubric.
So that is the one
It's a
approach.
laboratory microscopic way of understanding case.
Absolutely.
And zoom out is from very very minute to up to the kingdom and all universe.
So let's try to
Broader aspect
understand
of these.
this thing in a both the way, I can say. So regarding the zoom in, it is like try to understand the tree in the whole forest. It's like the microscopic examination of the case. Finding out the PQRS of the case, finding out the keynotes of the case, or do repertorization of the case. That is what we believe a zoom in homeopathy. Whatever we are doing till now, I can say in first year, second year, third year, fourth year, even during our MDs days, means when we learn homeopathy, our basic focus is regarding the zooming in to the case and to understand our case keynote wise through repertorization and finding out PQRS and give medicine based on the PQRS. So when I repertorize, so what are so all these are the PQRS symptoms of the case. The fear of falling down. This is one of the main keynote of this particular person, I can say. Am I able to convey to you? Yes or no?
Yes.
So fear of falling during panic attack, and at that time he feel vertigo and I will die. Fear of losing control over one's body. At that time, no confidence one's own body about being stable. Sudden startle from fright. Breathlessness, profuse perspiration. At that time, he also feels trembling of body, and he has also having a phobia of height and swimming. So when I repertorize the whole case, this is the original repertorization which I would done during the case taking only. The first medicine which covered almost many of the symptoms is Argentinum nitricum, followed by that calcarea, phosphorus, causticum, arsenic is also there, ignitia. Of course, problem is related with panic anxiety, aconite will be there, sulfur, lycopodium, nitramur, thuja, gelsemium is also would be in, I can say, in one of the
So
10
Gelsemium was
remedies.
very close. How to DD?
Yes, absolutely. Totally agree with. Even Kalikab is also there. Even China is also there. Rastox is. So many more medicines are there. So should we give Argentinum nitricum to the person? What do you say?
Yes, sir. You have to give Argentine nitricum.
Okay, of course we can. No doubt in it. Provided even the same medicine should come through the another approach. So to confirm our prescription, we need to zoom out the case and try to understand the bigger picture in the case. Now, what is bigger picture? To understand the forest, not only the tree. Am I able to convey to you? We need to understand the bigger picture, bigger issues of the case. We need to understand who is that particular person who is having this particular problem. We need to understand the system wise understanding. We need to understand kingdom wise understanding, Mahism wise understanding, superclass wise understanding. Am I able to convey to you? Yes or no?
Yes.
So of course we will give Argentinum nitricum if from the both the ways medicine will be the same. Am I right?
Yes.
So let's move further to understand and to understand this case and how to zooming out into the case. So we try to understand the given case in both ways. So I will not give you a kind of much more surprise till the end. The medicine which I have given, should I tell, is
Yes,
borax.
yes, sir.
I have given
No,
borax
sir.
1 and
No, sir. First, you explain us the zoom out way, and then we
I
can
will
even
absolutely,
think.
I will give you explanation.
Borat was not at all in my chat, so I am not at all convinced.
So that is why I'll
Why
give
not
you.
to take Argentinum or Elsimium, please tell me.
Sure. That is what we will do in the next 15-20 minutes. Sure. Okay. So let's understand borax in both ways. I can say, so whatever the explanation till now I am giving is related with zoom out way. Don't worry. So borax, where you find exactly borax? Regarding the kingdom, you are very much, most of you are very clear that DD would be gelsemium for sure. I will let you know why it is not gelsemium but borax. Sure, I will let you know. Okay. But he has the issue with one's own capacity, one's own performance, one's own would I have control on my body? That is what his basic sensation, I can say. So which has to do with mineral kingdom, capability, ability, whether this body is mine or not. So that's why I have given a medicine from the mineral kingdom. Why row 2, why column 3? We'll try to understand. So this is the periodic table, I can say. Are you able to see, all of you?
Yes.
So this is the first row, second row, third row, fourth, fifth, sixth, and seventh, in which borax is here. It is in column 3 and row 2. Okay. So look, what is zooming out? We need to understand each remedy and also our patient through system way, through kingdom way. So that is what we are doing right now. So first row has to do with the conception and existence. Am I exist or not? Am I in present or not? That is what the problem with the hydrogen line patient, I can say. We'll talk somewhat some another day regarding in depth if it is required, if we feel, regarding the row 1. Right now I will not go into the depth because the explanation regarding the borax will be left. This is the second row which has to do with lithium line, which represent the womb stage. So this lithium line has all these elements in it: lithium, beryllium, boron, carbon, oxygen, nitrogen, and fluorine. So whatever in repertorization Argentinum nitricum is coming is because of this nitrogen element of the row 3, and that is why Argentinum nitricum comes first into the repertorization. And in row 2, it has issues with birth and separation. Let's try to understand. So whole this periodic table represent the human stage, various stages of human development. First has to do with conception, second has to do with our life or our development during the womb, and I can say the whole stage of our pregnancy and labor, which has to do with row 2. Now row 3 has to do with once we come out from the womb, we have issues with love, care, nurturing, our own identity, our own ego. All these things will be there in the third column. Third row. Okay. So right now we are talking regarding the row 2, which has all these various stages, and depends upon the medicine, all these stages will be there. And in the same, I will say these row, I can say, or this particular stage of development also you will find in animals, in sea creature, even in plants you will find in subclass 1, and even in minerals you will find lithium line. So in all these medicine you will get a kind of a very much similar picture. Okay, this is just for your knowledge, a kind of a DD or correspondence, I can say. So these are just the first subclass which has magnolidy, or which has a pulsatilla or cocculus in it, or opium in this particular subclass 1. So all in all, you will find a such kind of sensitivity what we find also in row 2. These are the animal chart, where even in this column 1, in porifera, in cnidaria, even in fish, you will find a such kind of a so much so sensitive person who has tend to produce a such kind of panic anxiety. These are just for your knowledge, huh? So this lithium line, which has a very much weak ego. Why weak ego? Because still the child is in the womb. It is not separated from the mother. So their fear are again very vague, but very strong fear, like what we have seen in our patient. If there is something is going to happen, and that person feels so much so panicky, he would not be able to understand what to do and not to do. So even though fears are very vague, but they often drive their life, I can say, rule their life. So because of this weak ego, it tend to produce anxiety, and when anxiety is much more at a certain point of time, it tend to break off the ego defense mechanism, and which tends to produce various psychiatric disorders. Again, we find here they want to keep things in control because they feel that nothing is in my control. They are so much so clingy in nature. They need warmth. So all these symptoms you will find in all I can say elements of row 2. Am I able to convey you? Hello?
Yes, sir, definitely.
Okay. So they also need warmth, like a womb, like a child in the womb. They want hug. So clinging desire for. Even our patient do not want to remain alone. He also always want his wife with him. That something is going to happen. What happen if I go outside and something going to happen? So that is what a clinginess you will find here. Need to hug and wrap in love and affection and cozy feeling. And dizziness, again, vertigo is very much subclass 1 feature, I can say, whether it will be in plant or a mineral or an animal, I can say. In all these kingdom, you will find dizziness in first class subclass, I can say, or even in this row 2, I can say. They cannot tolerate any strong sensory inputs. They cannot face the world, and that's why they are so much so prone to panicky disorders. I want to start living now. They are having this dream of falling, pleasant or unpleasant dream of swimming. They are very much curious because they want to know the new world, and they are so much so reactive to sudden panic and noise, which you will find also in lithium, beryllium, boron, carbon, nitrogen, oxygen, fluorine. In all these elements, you will find the same thing. Unexpected situation, life and death situation. They are very instinctive and reflex reaction. They are having a many more fears like natural calamities, sudden danger for an animal, very acute crisis, falling or suffocation. And they are also having a claustrophobia in common in all elements, I can say. But more in those elements which are more left side, like lithium, beryllium and boron, you will find more reaction to sudden noise. They just startle. They are very instinctive. They are having this fear of falling. They jokes. They startle during sleep. And the remedies, those who are more on a left side, right side, like nitrogen, oxygen and fluorine, they feel more suffocated. They are having a claustrophobia, and they are having this desire to go out. I want my own space. I cannot remain here in this small room, I can say. While the carbon having all these elements together, all these symptoms together. So that's why many of you feel like you need to give something related with carbon or metal with some carbon. So that is because carbon is closest, and I can say that all these symptoms you will find in carbon being a center into the row 2, I can say. So in this particular case, our patient particularly stuck at the row in the row 2 and at the stage 3. Now what is stage 3? It is the stage where baby further descends down in the womb. There is a doubt about stability of the structure and doubt about one's own capacity. Are you remember the patient told us I want that confidence to feel my body. Are you able to convey? Are you able to connect the thread with our patient and with this medicine? Yes or no?
Yes.
So he has having this big doubt about one's own body. Is it my own body? I really want to touch. I really want to move. Is it my own body? So there is a big doubt, and that is why there is a fear of falling. Okay, do I have that control on my body? So there is an extreme fear of falling. Want to hold tightly because of instinctive response. You all know all these what we have learned, I can say, the multiremedica of boron or borax, I can say. Am I right? Have you learned borax? In borax you will find all these symptoms: fear of downward motion, fear of rides, even rocking, aggravation or amelioration. So this is the column 3. Now these are the common symptom of all elements which we find in column 3. I can say in row 2 borax, row 3 alumina, row 4 scandium. In all these you will find all symptoms. They feel not grounded. Again, very characteristic of all column 3. So that's why there is a fear of falling, because they feel not grounded. And the same kind of feature you will also find in gelsemium. So that's why you feel gelsemium could be the medicine. They feel so much so confused, no clarity. They are very weak-willed. They feel unsteady like a boat. He is having a fear of swimming, investigating, discovering and scanning of the case or the regarding one's own self. I have seen many cases of column 3 who are having a bunch of reports, ECGs with them. Okay, I am not able to understand what is happening to my body. I have done all kind of tests. Everything turns normal. So I really don't know what is happening with my body. That is what the scanning of the body, I can say. Underestimating, cannot make up their minds. They are so much so confused, would not be able to take decision. Wanting own structure, but doubt about one's capacity. Am I be remain alone? Am I be on my own? Oh, so that is what the thing. They need to hold and grip. They are so much so clingy in nature. So when we combine these both the things, our, I can say, understanding of row 2, which has a very much sensitiveness regarding the trifles, so much so fearful, all the elements, but along with this unsurety of column 3, we have our prescription borax. So they have starts doubting about mind and body, and that's why borax could be a very good medicine for OCD. And he is having a doubt about one's body, so that's why hypochondriasis will be there. They feel not grounded, not rooted, not in control. They are having a vertigo, fear of downward motion, fear of falling, doubt about one's functioning of the body. Am I connecting with you regarding this prescription? Yes or no?
Yes, sir.
Yes, sir.
Okay, thank you. So now here I would like to differentiate with the Argentinum nitricum, specific nitricums and borax. Why I have given borax, not the nitricum, even though Argentinian nitricum comes first in the repertorization because of this differentiation. Just keep this differentiation in your mind so that it will be easier even for you to differentiate these two elements, I can say. or the boron or the nitrates. Borax has a slow pace. So they feel that everything is too fast and I am too slow. Nitricum has a fast pace. So they feel time passes too slowly and which produces frustration and suffocation in them. While in borax, they feel time passes too quickly and they cannot cope up with the time. Just keep this thing in your mind. Huh? And if you have any question, please let me know. Huh? Borax you will find in left side of table. Nitricums you will find in right side of table. Borax need to be grounded more, while the nitrogen want more space. Borax crowd ameliorate the problem company desire for, while in nitricums you will find crowd aggravates. They do not want to be with company. They want their own space. Borax want to cling. Sorry. While the nitrogen wants separation, because that is the stage of the nitrogen in the row 2 where the child moves out from the womb and just it's a kind of after separation. That is what the stage of nitrogen I can say. Borax has a dilemma regarding should I be in or should I be out, while nitrogen feels stuck. Now I cannot remain in this small space. You must get out from this particular small area. So both feel things goes beyond control, but here things goes beyond control because of the slowness of the pace, while here they feel things are beyond because of the fast pace once of the because one's own state is so much so fast, so that's why they feel that these things occurs beyond control. Both wants to plan their life. Anything which has not they have planned, they feel so much so frustrated. So borax is very hesitate, nitricum is very impulsive in nature. Borax is very anxious in nature, nitricum is very angry and bursting in nature. Borax prefers home. Nitricums want to remain out of home. They want their own space, my own life. I want to live my life in my own way. That kind of a person. By a bit, I can say rebellious person. So here they are also having a fear of height, but when there is a fear, they want to cling to the person, those who are around. While in nitricum also you will find fear of height, but when they see from above to below, from height, they are having this impulse to jump from the height. So that is what the differentiation between I can say borax and nitrogen. The miasm wise, borax is more acute in character, while the miasm wise, nitrogen is more tubercular in nature. So regarding the psychiatry, I can say panic anxiety disorder with social phobia, with OCD and the hypochondriasis, you will more find in borax, while panic anxiety disorder with agoraphobia and claustrophobia, you will find more in nitrogen, I can say. So that is what the differentiation between these two elements. At this particular stage, any question? Do you want anybody want to share their if you have any question, I can say at this particular stage. Yes.
Anybody has any question or any doubt, you can ask.
Am I able to convey you? Hello.
Sir, it is very clear. Thank you.
Now, would you be able to differentiate between argentinum, nitricum, and borax? Why I have given borax and not nitricum?
Perfect.
But according to rubric chart, it is not coming, na, sir. We need to learn the theme of the each.
Yes, you need to learn. Of course, I will say you need to learn. Even I am learning. You need to learn. That is why you are here, na?
Yes, sir.
Yes.
And even repertory is just a tool. It not give you directly a medicine, right? You have to decide which one to choose. So this is perfect way, and perfect way we made a DD like which one to choose, Jalsemium, Argentum nitricum, or borax or carbon. So it's a perfect DD. Go ahead.
Any other?
Sir, where to refer the like this sort of theme-based study or understanding of the drugs in this aspect? Any book
There are many books,
we
I can
can
say.
this
You can
concept in more
refer
detail.
the structure book by Dr. Rajan Shankaran or the Elements book from Jan Scholten. Even book by Dr. Sachindra and Bhavisha, Periodic Table. These are the three books I know where you find all these understanding, I can say. Of course, these I have learned and experienced, and these I have done on my own way. But all these, the understanding you will get, I can say, from all these books.
Thank you, sir. Thank you.
Okay, yeah. Anything else?
Sir, a wonderful journey into the remedy, which we were totally unaware of. And it was an opening session. And we got the point how to zoom in into the core of the remedies rather than just relying on the repertory. Of course, repertory is a tool, but ultimately it's the core of the remedy. Thank you, sir. Looking forward to more series of this periodic tables, sir. We are you can say unaware of things. Thank you, sir.
Sure. Look, my purpose to show this particular case to you is that you should not even, I can say, fix yourself even to zoom in or even to zoom out. I will not say you just go system wise. Even it right now also in each and every of my case, I will do repertorization. But I will not stick or I will not fix myself just to repertorization. Okay. By the same way, I will also do the system analysis and all these things. But again, I will not stick myself even to the system analysis. I will also do repertorizations side by side. So I can say these both the things together will help you to confirm your medicine, I can say. So that's why both the things are very, very important, I can say. Okay. So let's, I can say, have a follow-up of this case. Just a minute. So after 1 month of the...
Sir, can I ask a question, sir?
Yes, please. Why not?
So when you do, many a times we do this way, but in the first case, if, for example, I'm trying to understand the things but this is a new method which we are trying to understand now. But as in when we are treating the patient, and if we stick to the way, I will say the zoom in way, wherein we are getting argentum nitricum, okay, and I'm getting the rubrics, and if I feel, the way which till day I have done, and I think many of my friends would have done that, we stick to the repertory, for example, and we give remedy to the patient.
Even I have done the same thing.
Yes, sir, that's what is many of us have experienced this and are undergoing this kind of an experience, because directly coming to the borax may see in the DD, or in fact when I was looking to the case, when you were specifying it कि तीनों में से कौन सा fear ज़्यादा common, you were trying to see in the patient which is the more important to you, and when the patient said it is a fear of downward, instantly borax came into my mind.
Absolutely.
Instantly. But then when we were trying to understand the whole other fears, trying to understand many other things, and then try to understand the things, then that was way. So first take at first hand, the argentum only comes into the mind.
Absolutely. And you are absolutely right. I will not say no. Look, if I just share my journey. Look, before 12, 15 years before when I prescribed medicine, I have a just basic understanding. So at that time, I prescribed Natramur in that particular given case. Over a period of time, when my understanding got better, I feel that okay, not only Natramur, but Pulsatilla also has the same kind of caring desire, warmth desire, attention desire. Over a period of time, again after some time, after some years, when again my understanding regarding homeopathic medicine got better, I feel rather than Pulsatilla, chocolate medicine from the Malwells comes very much closer to Natramur. So again, before which my prescription, which was Natramur, now that prescription was shifted to chocolate. Even after some years of experience, I feel कि अरे ये तो it's like more even the understanding which I have regarding the Natramur, the same understanding which I have regarding the chocolate, same kind of understanding I will also find in mammals. So the person to whom I have given Natramur or to whom I have given chocolate, I feel that lac caninum suits much more better way in that particular patient. So I will say which prescription is wrong. I will say no one is wrong. At that given time, whatever prescription which was coming in my mind based on the whole totality and with the good faith in homeopathy and with a good, I can say, we all want very genuine result for our patient. If I have that good genuine interest to cure my patient, none of this is wrong, I can say. Even my Natramur prescription also right, my chocolate prescription is also right. Even nowadays my Laccan or Lac defloratum prescription also is going to right, and from all this prescription patient has got benefited. So I will not say when one thing is right, the remaining here are wrong. I can say you do your best at this particular time and whatever tool you have, I can say.
Right,
Am I
sir.
able to
Thank
convey?
you. Thanks a
Sir,
lot.
what remedy you said similar to Pulsatilla?
Chocolate or
Chocolate.
Lac caninum or Lac defloratum. Many more medicines, I can say. But all these medicines are right in their own way. I will not say only one is right and remaining are wrong. It doesn't happen in homeopathy, at least I can say. Truth is not only one, it has a multifacets that I have seen. I will not say that there is only through the similimum we can get result. Even the closest similar medicines will give you results. So don't worry. If you have the Repertory as the case, you are quite sure regarding the Argentinum nitricum, go for it. Don't worry about the other thing, I can say. Okay, ji?
Yeah,
Thank
thank
you.
you, sir. Thank you,
Thank
sir.
you for this clarification. Thank you.
नहीं I also have this so called guilt feeling कि अरे यार ये तो medicine सच्ची मिल ही नहीं रही है, but it is not like that, never, I can say.
May I ask which potential you were given?
Yes.
Which potential?
Potency.
Yeah.
1M.
1M.
Yes.
Thank you.
Whenever is required, frequently repeated.
Sir, right in beginning of the case, you gave us such a big hint regarding what you asked the patient regarding which is your greatest fear. Even then, we couldn't ponder on your highlight. We still need to be refined, sir. Thank you once again.
No. We all are at the same stage. Don't worry. So again, we come back to our follow-up thing.
Can we have a more session of zoom out practices of different cases?
We can do. I will discuss with Dr. Ghanshyam. Sure.
Okay,
I have no issue. Okay, Hanji. So regarding this follow-up, so after 1 month, he has no headache and no anxiety like before. Sleep is sound. Weakness and numbness is there, but less than before. After 3 months of follow-up, still feeling stressed out, but now I can handle the things. I feel more energetic than before. No negative dreams like before. Sexuality also. So again, issue of performance. Also feel okay. Before cannot perform properly. Here, even the allopathic medicines, doctor has reduced the dose of allopathic medicines. Follow up after 9 months. Better even than before. Sometimes getting headache, but not like before. Now I can travel alone. Feel more confidence in myself. Not getting attack like before. Stop allopathic medication 1 month back. After that, again for the next 3 months, he has continued with the treatment. And after that, he has left to the treatment as he has done well and he has no issues. So, anything else? Yes.